Hey everybody, Tim Weyant Clinical Specialist, shooting a video here today on COVID and capsular contracture. It goes without saying, COVID has probably been the biggest topic on all of our minds around the world for the last year. I'm shooting this video today because in the last month and a half, we had some really interesting news, things that we're seeing that we'd like to clinically correlate. So we're putting this video out there because I want some feedback. I want everybody to drop some comments down below if your experience could be relative to this, because capsular contracture, as everybody knows, or if you may not know, is an autoimmune-based dysfunction. So let's dive into this a little bit more. What is COVID? COVID is basically a virus that infects the body and creates certain autoimmune issues that the body tries to fight. Now, the good news with COVID is the majority of people who are either infected with it or even a carrier of it may not have any serious problems. Some percentages do, but no different than a flu, a cold, or any other problem in our body. The body tries to fight it, and it does certain things in the process of fighting it. That is exactly what capsular contracture is. Capsular contracture is where the autoimmune system sees the breast implant, forms a wall around it, aka the capsule, but in the event that it really doesn't like the capsule relative to certain things, it causes that thickening and squeezing process, which is why if you are an individual suffering from contracture, it all does the same thing. It rides up high, the implant doesn't drop, it can become firm, and in some cases can become painful. So let's relate this to other stuff. What are other things that we know that can cause capsular contracture? Well, if we look at our thyroid, patients with thyroid dysfunction have a higher incidence of capsular contracture because the thyroid controls metabolism, which links into our autoimmune system. Just like Graves' disease. Graves' disease is technically a thyroid issue, but it creates an autoimmune problem. Other issues that we see that can cause capsular contracture are chronic sinusitis. So patients that have chronic sinus conditions, seasonal sinuses, require frequent visits to the doctor, antibiotics. We see a much higher incidence of capsular contracture in those patients. How about colds and flus? Certainly. Patients who have come to us over the years have reported that prior to the onset, they had a very bad bout with a cold, a flu, infection, or some other type of immune-related condition. Dental procedures. Dental procedures could possibly cause capsular contracture because our oral cavity is full of bacteria, just like our tummy and our belly, and procedures that are invasive, wisdom teeth pull, drill, fill, poke, pull, anything that is invasive within our mouth that creates bleeding can release bacteria, and the autoimmune system goes looking for that bacteria, and it sees the breast implant and thinks the breast implant is the invader and attacks the breast implant by encapsulating it. So we see lots of these autoimmune triggered based disorders. Could COVID cause it? It could. So the reason why I'm shooting this video today is because within the last month and a half, we have had 3 patients report an insidious onset of contracture. Insidious meaning we don't know why, they didn't have surgery, they've had their implants for a really, really long time, but yet capsular contracture still popped up. So when we dug a little bit further, we said, what are some of the commonalities behind these 3 patients that we discussed? All 3 of those patients had had the COVID vaccine a few weeks prior to the onset of the encapsulation. So theoretically, a vaccine is a weakened form of a virus which gets injected into our bodies that we build an immunity to help us defend against a more serious one that could actually attack us, to try and prevent it. So we build an immunity. Well, in that immunity, which can sometimes cause weakness, fatigue, pain, almost flu-like symptoms, we try to build the immunity, but in that process, theoretically, our immune system is triggered. So could it cause capsular contracture? It could. I want to get some feedback from you guys on this. Anybody watching this, I want you to drop some comments below on your thoughts and feelings on this. any patients who are newly encapsulated, or you're coming to our channel for the first time and you think this may be an issue, either COVID, autoimmune, cold, flu, or other, drop us some comments below. We'd love to have a dialogue of this and share this with the community of other people and clinicians to be able to share this, to talk about it, okay? As usual, guys, hit that subscribe, click the likes, share this with everybody. Subscribers, please hit that. We want to share you new updated information like this. Also, look at the banner below, hit the 800 number up. You can always call us, talk to us about this. Don't forget we offer virtual evaluation. So anybody out there that's dealing with contracture and thinks that you have to have surgery, you don't. Do a virtual evaluation with us. We can check you out, look at you, do a physical exam, tell you exactly what your stage and grade of your encapsulation is, and let you know if you can do the Aspen non-surgical treatment, okay? Speak to you guys soon.